I have been receiving a number of requests from people saying that you have spoken about all the complications of diabetes, eye, kidney, nerves, heart, feet, everything you have spoken about. But you didn't speak about skin and diabetes. Is there any connection between skin and diabetes? Of course, there is a huge connection between skin and diabetes. In fact, many people are diagnosed to have diabetes after they have a skin problem. I'll give you a simple example. Itching in the genital area or inflammation, redness, both in men and women in the genital area. We call it as balanitis in men and vulvovaginitis in women. This is a classical sign of diabetes. 95% of people who have this will have diabetes, and that is how they go to a skin doctor, and the skin doctor will say, have you tested for sugar? No, I don't have diabetes. No, just do a blood test. Blood sugar will come as 350. So then they are diagnosed to have diabetes. So that's a very common symptom. But then there are many other symptoms. From simple abscesses, you can get an abscess as shown here. A small boil, in layman's term we call it as boil, otherwise we call it as an abscess. Furuncle, we call it. So in the skin, if you start getting in different places recurrent boils which are coming, it means that your skin itself is full of sugar. Urinary infection, very common, because the urine in the bladder is full of glucose, and in that bacteria can come, and so recurrent urinary infection can come. You can get fungal infection. For example, between the toes of the feet or in the hands, between the fingers, if you get a fungus infection, we call it as intertrigo. As you can see in this picture, between the toes you have a fungus infection, very common in diabetes. Sometimes the nails can get discolored. So you can see in this particular picture is a normal nail of a person, white in color or pink in color. Look at this person's toes. You'll find that it's all brown in color. It's also raised, and if you look under the nail, you can actually see the fungus infection. Very common in people with diabetes, and if you don't treat it, that itself can lead to a foot infection. A simple intertrigo can result in a gangrene. Now, people who have uncontrolled diabetes for a long time, their feet can get involved. The first symptom is neuropathy. You may not find any sensation when you're walking on the ground, as if you're walking on a soft mattress. The ground will be hard, but you will be thinking you're walking on mattress. Or your chappal falls off and you don't know about it. And then will start the burning and the pain in the feet. These are all symptoms of neuropathy. But then what happens is, because you have neuropathy, you start putting more pressure under the feet, and right under the first toe, metatarsal head we call it, right under that a corn can develop or a callus can develop. A callus is nothing but thickening of the skin. As you can see in this particular region, this is a typical callus. What happens to callus is it will break, and then an ulcer will form. That is what we call as a foot ulcer. That ulcer can get infected, and then you have a diabetic foot with cellulitis, which can even lead to a gangrene. So you can see that even a small skin problem can become very serious later in life. Now, as you have long duration of diabetes, certain changes start occurring in your feet, your hands, your back, and so on. One of the conditions which is very common in all those who have 15 years duration, if you have diabetes for more than 15 years, have a look at your shin area, your leg area. You will find that there are brown spots there. That is called as diabeticdermopathy. You can see one picture here, one illustration of diabeticdermopathy. It's very common. Those who have diabetic dermopathy may also have nerve changes, eye changes, kidney changes. So this should alert you to look for other complications. So diabetic dermopathy occurs in those who have 10-15 years duration of diabetes. There is a classic sign, two classic signs of diabetes, which once you see, you can say that this person has diabetes. One is called granuloma annulare. You will get a small circular fungus-like patch. As you can see in this picture there, this is granuloma annulare. The difference between granuloma annulare and fungus lesion is that fungus lesion will itch, whereas granuloma annulare does not itch. And then there's one more condition, we call it as NLD, necrobiosis lipoidica diabeticorum. Nothing but a degeneration of the skin due to diabetes and with fat deposits there. So that is another classical sign of diabetes of long duration, and these are all classical signs. They occur only in people with diabetes. It does not occur in people without diabetes. If your cholesterol level is very high, abnormally high, especially if you have hereditary cholesterol problem, then you can develop what is called as xanthoma. Xanthoma is nothing but a fat deposit, a cholesterol deposit, which can occur on your fingers. We call it as tendinitis, xanthoma tendinosum we call it, or it can just hang like fat deposits in your skin, as shown in this particular picture. If an eye doctor is looking at your eye, instead of the blood vessels which are red in color, that ophthalmologist will be able to see something white going there. What is that white? The whole blood has become full of fat. So much of fat, so much of cholesterol, we call it as lipemia retinalis. The whole thing becomes white in color. It's a dangerous thing because it can lead to heart attacks. So you can see that right from bacterial infection, viral infection, even herpes zoster. Nowadays we have the shingles vaccine, isn't it? And why we recommend people with diabetes to take it is because herpes simplex and herpes zoster, as shown in this picture, it can occur on your face, it can occur on your chest, on your arm, anywhere along one nerve root. That is called herpes. So it can be herpes simplex or herpes zoster. Herpes zoster can be very painful. When it heals, it can heal with pulling of the nerves and produce severe pain. That is why we recommend vaccination of using the shingles vaccine. So if you've not had it, you can come and ask us and we'll be happy to give you this shingles vaccine. So like this, you can see viral infections, bacterial infections, fungal infections, definite infections due to diabetes themselves, which are classic of diabetes. And of course, the one which I keep talking about often is acanthosis nigricans. Acanthosis nigricans usually occurs in the neck. As you can see in this picture, a velvety, brownish kind of thickening of the neck, the skin of the neck. Now, what does acanthosis nigricans indicate? It indicates that you've got insulin resistance, that your insulin level is very high, that you're overweight or obese, the insulin is not working properly, and therefore the skin is showing this manifestation of acanthosis nigricans. If you have acanthosis nigricans and you are a child diagnosed to have type 1 diabetes, it may not be type 1 diabetes at all, it can be type 2 diabetes. Acanthosis nigricans is reversible by controlling your diabetes well, by weight reduction, your insulin resistance can come down and acanthosis nigricans can go away. So from the head to the foot, including the head and the foot, any part of your skin can get affected due to diabetes. So the next time you see any skin changes, if you have diabetes, please tell us and we'll be happy to examine it and find out whether it is something serious or it is nothing. Sometimes you just leave it alone, you don't do anything. Sometimes you have to give an antibiotic or you have to treat it so that that infection goes away. They always say a stitch in time saves 9. That means one stitch if you put, you can prevent 9 stitches later. So in that context, looking at a skin problem, identifying it early may help you to prevent more serious complications from coming, and that is why it's very important to have a thorough examination of the body in everybody who has diabetes. So let me wish you all the very best.
For appointments, contact 8939110000 and write to contact@drmohans.com.